Episode 218, Understanding the Difference Between Coaching and Therapy with Niki Olsen.
Welcome to Latter-day Life Coaches, the podcast where each episode is a conversation between me, Heather Rackham, and one of my amazing coach colleagues. Each coach here is a member of the Church of Jesus Christ of Latter-day Saints and a highly trained, experienced life coach making a great impact in the lives of their clients. And together, we have one main goal, helping you live your best life no matter what. You ready for this conversation with a coach? Here we go. Today's episode is going to look a little bit different than most episodes. Most episode, it's me, joined by another coach listed here on the directory. But today, I wanted to have a conversation that clears up a lot of misconceptions about the differences between coaching and therapy. I often hear people ask, do I need a coach? Do I need a therapist? And even AI, as you will hear in this conversation, seems to get this one wrong. So that's why I brought in therapist Niki Olsen. She's a licensed therapist, and I wanted to just kind of break this down. So in this episode, we're going to talk about a couple different things: the difference between coaching and therapy, why coaching is valuable and a viable option for personal growth, and how they can kind of work together to support your journey. If you've ever wondered whether coaching is enough or questioned how it differs from therapy, this episode will change the way you see both. So I think you will enjoy it. Whatever you're doing, if you're doing laundry, you're driving down the road, wherever you are today, I hope it's a good day, and thanks for being here with us. Hey everyone, welcome to the podcast today. I am joined by a special guest. I usually have life coaches on here, and today I have invited a therapist to join me. You've probably seen her on Instagram. Niki Olsen is her name, and I'm going to have her introduce herself here in just a second. But first of all, I just wanted to thank you, Niki, for coming on and being willing to come and have this conversation with me today.
Absolutely. Thanks for having me. I'm excited. Yeah. So I kind of have this dual kind of crossover world. I am a licensed clinical mental health counselor in the state of Utah. My day job is that I work at a community health care center on the Navajo reservation. And so right now I typically supervise therapists, and we have lots of different programs, and we can talk about that behavioral health coach program. I actually supervise behavioral health coaches and behavioral health technicians within our agency. And then I also run a private coaching business called Niki Olsen Coaching. And I host a podcast called the LDS Mental Health Podcast. And yeah, so we offer services that are mental health skills taught through a spiritual lens, specifically for members of the Church of Jesus Christ of Latter-day Saints.
That is awesome. And what a unique, I think, like as you talk about where you work on your day job, like that's a unique place. You don't hear people working in that setting very often either. So how fun.
Yeah. It's kind of different. When I do therapy, we also have traditional counselors. So we kind of have the array of people who work with us. So we have traditional healers that will come in and do ceremonies or songs or prayers from the traditional Navajo perspective. And so we work through them where they teach through stories and songs and things like that for healing. So it's kind of a fun crossover also to see a mental health like Western world with the traditional Navajo world kind of intersect. And then I love on my own private side being able to intersect mental health with the spiritual world. So I think it's kind of taught me a lot on both sides.
That is fascinating. And I think what I love about that is I think sometimes as, you get in your own religious culture and your vision gets kind of stifled maybe to
Yeah.
other areas of growth that are available to us, other ways to access growth, I guess I should say.
Yeah.
And so that's awesome. I think there's
Yeah.
so many tools out there that we leave untapped and really speak and fit perfectly well within our religious theology too.
Absolutely. Absolutely.
Well, I wanted to talk today a little bit about the difference between coaching and therapy. As coaches that are, listed here on this directory, obviously we're coaches, and we often get asked, what's the difference between coaching and therapy? And who better to talk to about that than somebody who is labeled a little bit under both of those areas? So would you mind talking about that a little bit?
Yeah, I think there's some, and it's really left to interpretation. There isn't
Hmm.
anything that like specifically says this is what this is and this is what this is. And Utah, I think, is trying to kind of narrow that down.
Yes.
But and if you go like Google, I went to like Chat GBT because I was like, I'm curious, what do people
Uh-huh.
say with that? And the often response that you get is, well, therapy deals with the past and coaching deals with the future. And it
Mhm.
was interesting. I had this little conversation with Chat GPT. I was like, I don't agree with that. And they're like, interesting. Why don't you agree with that? And I had this little conversation. Turns out you can have conversations with Chat GPT.
I'm
But
figuring that out too, and it's pretty interesting, isn't it? It's fascinating.
yeah, yes.
Yeah.
And so because I just don't think that that may have been 10 years ago, 15
Hmm.
years ago. Like a coach was somebody who worked with you on goals and skills and, leveling up your future, right? That's
Right.
how you looked at it. But I also think that coaches are really good at working on your limiting beliefs that were from your past that are holding you back from your future, right? That
Yes.
coaches also can focus on the past and be able to recognize those cycles and those patterns that are happening in our lives because of our past to
Mhm.
help free us up to go to where we want to go in the future. So I think that they overlap a lot in areas. I would say the distinct difference that I often tell people when they say, because I get the question a lot, like, are you taking new therapy patients? And I say, not online, I only do coaching. And they'll say, well, what's the difference? And I say, well, you won't receive a diagnosis from me. We won't be talking about a specific diagnosis, which means that I won't be billing your insurance. And then also, I won't be working with anybody in like a crisis situation. If you're dealing with a situation where you're having active suicidal thoughts or you are in an unsafe situation, I'm not going to be able to work with you. I would need to do that under my license. And I'm not set up to do that online. And so I'll kind of vet out those things, right? And
Mhm.
then I specifically say that coaching is skill building, that we're focusing primarily on skills that will help them in the area that they want to work on, right? So that's
Mhm.
kind of like where I start with that. But I would also say, and I think that there's different methods, that people can use. As a therapist, I can go get trained in modalities like cognitive behavioral therapy or acceptance and commitment therapy, or, there's lots of different dialectical behavioral therapy, right? I can get
Right.
trained in those, but when you really look at those and you kind of pull them apart, they really are just skills, right?
Right.
Like
Right.
a lot of people who are trained in the life coach school are trained in what I would call a cognitive behavioral therapy modality, right? Like
Yes.
it's
Yes.
very much what it is, right? And you can just call it something else and you can just call it a skill, right? And it really is you're not saying it's therapy, but I think that's where it can kind of get, there are no distinct differences where someone says this is the way it is and this is the way it isn't.
Hmm.
Therapy is a regulated field and coaching is not a regulated field. So, but I also think you can find, unprofessional, unethical therapists in a regulated field, right?
Yes. Yeah.
And you can find really awesome coaches who are ethical and guided by good practices and keep their clients safe in an unregulated field. So I think that there's crossover for both, but I think it really has to be up to the consumer to do their own due diligence in whether this is a good fit for me and is this really what I need.
I appreciate you making that distinction because, well, first of all, I have seen anybody can call themselves a coach. Like you said, it's
Yep.
unregulated. Anyone can call themselves a coach. And so it is important. It is up to the potential client, the consumer, as you call them, to do some research. And just because maybe you met with one coach doesn't mean that maybe it wasn't a good fit for you.
Right.
And you could maybe find a better fit with another coach, but sometimes I think people have the tendency to just, I don't know, throw the baby out with the bathwater if they've had an
They do with
experience,
therapy too,
right? And
though,
it's the
right?
same with the therapist, right?
Yeah,
I've
therapy
I
doesn't work for me because I didn't fit with that therapist.
Yes, yes.
Yeah,
I have had so many clients that have been like, I've tried therapy and it
yeah,
didn't work. And I want to
yeah.
say, Well, you maybe needed to see a different therapist,
Yeah.
right?
Or different,
Um,
they have a different approach or they have a different
yes,
place. Like I think therapy and coaching is very much about a relationship. And if you
absolutely.
don't feel like you can connect with that person and open up and share what you need to share, and that person doesn't have the ability to teach you and coach you and provide you what you need, then it's not a good fit. It doesn't mean that that whole modality or, you know, area of therapy is
Yeah.
bad.
Yeah, absolutely. Thank you. Thanks for clarifying that. I think it's a really good thing to have a conversation about. And we talked about this a little bit before we started recording, but there is some legislation in the Utah area, not the area, but in
Yeah.
Utah itself
Yeah.
that's kind of trying, like you said, trying to distinguish the difference between therapy and coaching. And it's just good to be educated on it. And
Yes. Yeah. It's kind of interesting how things work, and I'm kind of figuring this out from from experience and working with this. But legislation comes out and says, this is what we want. We want to be able to have the mental health world is really lacking in people. Like we
yeah,
just don't have enough people coming into the mental health world, right? And so they're trying to create lower education levels that can help alleviate some of the burden that we feel as master level clinicians. And so, what legislation came out with is we need an associate level certificate and we need a bachelor level certificate. And this is the scope of practice that these people can do in
okay,
what they can how they can work with a client and what's within their realm of what they're allowed
gotcha.
to do. So a behavioral health technician, well, let me back up. So legislation comes out and says we want this, right? And then it has to go through the Utah Division of Occupational and Professional Licensing because they now have to make a way of somebody getting a certificate with that, right?
Right.
And so even though legislation passed in April, they are still working on regulating this system. I've hired people within it and we're still trying to work with them like what counts, what doesn't count. Like we have people with associate's degrees and they're saying, well, this associate degree counts, but this doesn't, and you have to have an internship in this area with 40 hours of this. And so it just becomes this like over-regulated system, right? But
Yes.
the scope of practice, I think, is really important with that of like, so I have behavioral health technicians within our agency that work on the medical side. So we have medical, dental, vision, behavioral health all in one roof, right?
Okay.
And but we're integrated healthcare, which doesn't necessarily mean that a medical provider just says, go see your therapist, go make an appointment. That's not true integration. True integration is a warm handoff. You have somebody from behavioral health right in your medical room talking to you right when you score positive on your depression screening, right? Or the doctor prescribes you some medication for depression and wants to connect you with behavioral health, right?
Mhm.
And so we hired technicians that will go immediately into that room and talk to them about all the resources we have available within our behavioral health department. They'll help them make those appointments. They make sure they show up to those appointments. They call and ask how that appointment went. Is it a good fit? Is it not good fit? And they follow them monthly. They just check in with them every month, making sure that they are provided the resources. I call them our bridge people. Like we're
Mhm.
bridging the medical side with the behavioral health side. So that's sort of a technician. And you can use technicians in different ways. A behavioral health coach might be somebody who's teaching psychoeducational classes. So maybe they're teaching anger management classes. Maybe they're teaching a grief support group. Maybe they are teaching a parenting class and they have a bachelor degree and they've done an internship. They know how to work with people. They have training in crisis intervention and crisis management. And they have an ethical guideline that they need to follow. And they can go in and do pre-assessments for therapists. So they can go in and do like maybe a social history with them and ask them a bunch of social history questions, or they can do some depression screening, some anxiety screening, so that when they come in and see me as a therapist, I can get just down and talking with them. And all that pre-screening has been done by a behavioral health coach. So that kind of gets regulated in that world. But I don't think it's really regulating. And I don't know if I know that down the road, Utah wants to regulate the coaching world, but I don't think that behavioral health coach is necessarily a regulation of the coaching system within Utah, if that makes sense.
Yes, it does. Yeah, I don't live in Utah, so I've been hearing the conversation and just it's nice to have, I don't know, to get a little bit more education about it. So, and I do think there are some things coming down the line for life coaches in general, but I bring all that up just to say that I do want people to continue to know, and it sounds like you understand that too, that coaching is a viable option for so many things. Like you said, there's a lack of mental health providers out there, and we certainly cannot discount life coaching as one of those possibilities of a way for help. So,
And I've seen lots of people's health savings accounts pay for coaching. Like
hmm
you'd have to check into that, but a lot of health savings places offer you to use your money for coaching services in a specific area, right?
yeah,
And
yeah.
I think that's the nice thing about the coaching world is they have a lot more specific niches, right?
hmm
Niches.
I know, however you
Yeah,
say
yeah.
it,
However
potato,
you say
potato.
that. Yeah, yeah. So they can get more specific and you can say that person is going to help me with my specific need. I feel like in therapy I get asked a lot like, well, who's a good therapist for this? And we don't do really good. Well, and there's a reason. Like there's no way I could niche down in a town of 3,000 people, right?
Right.
Like I have to just know how to help everything because our closest referral source is 5 hours away. Like I can't
Right.
refer for anything. So I just have to learn how to deal with that, right? And so there aren't options for people to say, are you just a trauma-based therapist? Do you only help people with bipolar disorder? Are you only a couples therapist? Like we don't have that availability here.
hmm
But in bigger cities, they might have that. But I also think in coaching, it gets even more specific than that, right?
Yeah,
And you can
absolutely.
find somebody who just works on skills in this area of your life. And that, yes, that's the thing that I want to focus on. And I think when we can narrow it down to something smaller, it feels more doable in our brain, right? Like, yes, I am just going to work on this area of my life. And we know that working on one area of your life is going to help lots of areas, right? But
hmm
it just makes it more doable and approachable when we
Yeah.
have that smaller niche.
Yeah, so true. You have a program that I hear you talk about on Instagram. I'm going to probably say it wrong just because
That's
I'm
good.
talking to you right now, but it's like how to hear him in the chaos, or
Uh-huh.
did I
Yeah.
say that
Yeah.
right?
Yeah. Yeah. Yeah.
And I think what you just said is really speaks to that, right? Like
Yeah.
we have certain things in our life that kind of help life feel chaotic for us. And
Yep.
if we can learn the skills in that area to be able to hear personal revelation for ourselves, it crosses over then into every other aspect of our life. And I think that's the thing that people don't always realize. Like you might come to coaching to a
Yeah.
specific niche in a specific niche, right, to get help, but it ends up seeping out into all areas of your life.
Right. Yeah. Because specifically what I've niched that down to is that revelation is one of your greatest assets to your mental health
Mhm.
and to your life, but your mental health is the barrier to receiving revelation, right?
Right.
And so how can you use mental health skills to remove that barrier to receive the revelation that actually helps you move forward in your life, right? To know
Mhm.
what direction to go, know how to help the people that you love and how to be more efficient and motivated and know where your time is best spent, right? That revelation is the best resource for that. But sometimes the chaos, because the opposition is around us all the time. I mean, it's part of the plan, right? The
Right,
opposition is
right.
here. And so there's going to be chaos in every aspect of our life, right? And so if we don't learn to use skills in the midst of that chaos, what I see a lot of women trying to do is remove chaos from their lives. That's never going to happen. You can remove one thing and the next thing is going to come. And so you're just like on this hamster wheel trying to like get rid of all the chaos in your life. And what you really need to do is focusing on being able to manage in the middle of chaos. And
hmm
that's where mental health skills can really help you not try to manage the outside world, but manage yourself and be in the world of chaos.
Yeah. That is so true and so good. I see people, my clients, a lot of times who think, I'm not getting answers. And so I must be doing something wrong
Yeah.
because we kind of have this rhetoric in the church that if you're faithful, you'll get answers. And we think that if we're not getting answers, then we must not be faithful enough. And it's that hamster wheel.
Yeah.
And that is so it's scary for people because they think, like I'm never going to get this right. And
Yeah.
so when you can kind of come to learn and understand how to clear that out, it really has nothing to do with your faithfulness.
Yeah,
And
exactly.
and then that, when we think that, that affects our relationship with our heavenly parents. And then
Yeah,
it just everything starts to come crumbling down. And when you can come to realize that it's not really connected. I mean, it is to some degree, but for the most part, like your ability to hear and understand and receive that personal revelation is it's not connected to the things that you do and you don't do for the most part.
exactly. Exactly.
Yeah.
Yeah. Yeah.
Oh, so good. So I'm curious if you don't mind, like, what do you like your people that come to you? And like you said, you work with LDS people in not your day job.
Yeah. Yes. Yep. Yep.
What do people come to you most for? Is it just learning how to kind of control that chaos, or they
Mhm.
think they're going to control the chaos? What do you
Yeah.
see people for mostly?
Mostly people want to learn mental health skills through the doctrine and faith that they believe in, right? They want to understand, how does mental health fit into this world? And what I see a lot of women struggling with is the anxiety of life, being able to keep caught up with everything, right? Like I never feel like I'm doing enough. I'm always, the more I do, the less I feel like I get done, and I just feel like I'm always behind. I'm overwhelmed. I can never get caught up. The other aspect of that is the inadequacies that we feel in life, the never good enough. I'll never be good enough. What's the point in trying? So, kind of feeling like I don't ever measure up. I'm always comparing myself to somebody else and I don't measure up to them. And I would say the third category of women that come to see me is they're just struggling in their relationships, whether that's someone that they love is struggling and they don't know how to help them, or there's conflict in one of their own relationships and they're unsure how to move forward from that, or they've had some hurt that they need healing from past relationships. Maybe they're not even in that relationship, but that relationship is still causing them pain and hurt, and they
Mhm.
want to be able to heal from that. So I would say those are kind of the three areas that women typically come and see me for. And then
Mhm.
I use a specific modality called mind body bridging, where it's more of a mindfulness approach where we work on understanding what thoughts are triggering us into a state of disconnection from God. And the natural man is that place, right? The natural man is the scriptures talk about it being without God. God cannot go there. It's the place that gives us agency and choice. There has to be a place of opposition inside of us where God cannot reach, so that we will choose to return back to God with our agency and our choice. But sometimes we get so overwhelmed, like the natural man is the one that's producing those thoughts and feelings of inadequacy. The natural man is what's telling you that you don't need to try in this relationship. It's never going to work. You're not worthy of healing, right? Or you'll never be able to stay caught up. It's the natural man that's causing those thoughts and feelings inside of you. So if we can learn to put that natural man to sleep and return back to our divine state where we're in connection with God, our mind, body, and spirit are all in connection, then we can receive any amount of revelation we want to. And we are now kind of what I call the dream team, right? Like we're in connection with our heavenly parents, with the Savior, with the Holy Ghost, and we can receive all the power that they want us to receive. But we live in a fallen world by design, with fallen bodies, with people who use their agency unrighteously. So we're gonna get triggered out of that state back into the natural man state. And we need to understand those triggers, and we need to diffuse those triggers so we're not triggered there as often. And then we also need to work on diffusing those thoughts once we're in the natural man state so that we don't get wrapped up into it so quickly. I like to say, like, putting out a campfire is a whole lot easier than putting out a forest fire, right? So if we can diffuse take a lot of that fuel away that the natural man uses to get us fired up, then we can, when we get triggered there, we can put that campfire out and return back to God easily, rather than getting so riled up, so disconnected that we're confused, we feel worthless, we feel like we feel faithless, and that what's the point in trying? And so then we fall into that all or nothing thinking.
I love that you've just mentioned before, it's really all about skills, right? And it's those skills that you learn that can help you stay connected to that personal
Yeah.
revelation.
Yeah.
I started learning coaching tools and skills. I was like, Oh, wait, this is kind of like the how to actually live the gospel of Jesus Christ that I have been learning about my entire life. But all of a sudden, it felt like I was given kind of steps to do it that helped kind of clear out some of that clutter in my head that were keeping me from doing it.
Yes, exactly. Yeah, yeah, and we need resources. I mean, in general conference, the prophet and apostles are constantly talking about reach out for the mental health support, for resources. Skills doesn't mean you needing extra skills doesn't mean that you have a character defect or something's wrong with you. Like
Yeah.
we need to reach out for that extra support and help.
Mm-hmm. Yeah. What was the modality that you said that you use often with your clients?
It's called mind-body bridging.
Okay, mind body
Yeah.
bridging.
Yeah.
It's so interesting. And I think that's the same, like for many coaches, those modalities that you mentioned with therapists, there is a lot of like coaches can also learn about those modalities and use a lot
Yeah.
of that thing as well.
Yeah.
There's so many tools out there for us to
Yeah.
resource.
Yeah. Yeah, absolutely. And I wouldn't say that one approach is like the approach.
No,
I
absolutely. I
think
think different.
everyone's brains work differently,
Yes,
right? And
yes.
so find an approach that works for you. Like go
Mhm.
out and listen to people talk. Like I love people to come listen to my podcast and then say, do I resonate with what Nikki's talking about? Does this make sense to me? Is this how I want to approach my mental health? If not, that's great. I'm not for everyone, right? And
Right.
somebody else might be that approach and person that could connect with you.
Yeah, for sure. Well, Nikki, thank you so much for talking with me today. I just wanted this to be kind of a bite-sized episode where people could just kind of come and, yeah, what is the difference here? And I know coaching has been around for a while, and still a lot of people don't know where it is, don't know what it is or how they can access it, and if they should or if they shouldn't. And
Yeah.
I think
Yeah.
you've been really helpful in that conversation today.
Thank you for having me. It's been
Oh,
wonderful.
thank you so much. Tell people where they can find you on Instagram and your courses that you have. I think that'd be helpful for
Yeah.
them.
So, Nikki Olsen Coaching on Instagram, and my website's the same thing, NikkiOlsenCoaching.com. My website or my podcast is called the LDS Mental Health Podcast, and that's on most podcast apps, Apple, Spotify, Audible, YouTube. You can find it anywhere.
Awesome. We will link to all of those things in our show notes here so people can find it. But I really appreciate your taking time to kind of educate us today and educate our listeners, and appreciate it. Have a good day.
Awesome. Thank you.
Yeah. Thanks to all of our listeners for being here. And if you have any questions, let us know, and we will see you again next time.
Hey, we just wanted to thank you for spending part of your day here with us at Latter-day Life Coaches and being part of this conversation. Share this with your friends so that you can have a conversation with them on this topic as well. And as always, subscribe so you don't miss a single episode. Have a good one, my friends.